Jointly with the County Assembly Health Committee of Kisii, and we have had a very good inspection. We have a number of observations we've made in the facility, and we need to sit with the executive Kisii County government to make recommendations as we put one to our report so they can be able to address. In brief, there are particular areas that are of urgent concern. One is the supply of oxygen. This facility, we've seen that the staff at the theatre have just informed us that they are experiencing challenges with oxygen supply because the plant seems to be having challenges. And we think this is what counties should be able to address. We know Kisii County Referral Hospital, some 1 year, 2 years back, was not only able to supply their own oxygen, but they were also able to supply to nearby facilities and counties. Areas we have noted that are offering exceptional services. One of the best places we have visited, and I think amongst the counties we have visited, is Okenyuri. You can't believe the services that are available. In fact, you can only compare the services we get from the private homes.
Chumba cha kuhifadhi mili. Ningependa kuwapongeza sana kwa kazi ambayo inaendelea pale.
We are here on the qualification and we have seen many gaps there in this hospital. Here amongst them, I think we need to digitize because of course there is era now of information technology, and we went to the pharmacy and there are issues there with records. We need to digitize. There's a gap that we achieved without putting on the GRC. It's at the oncology clinic. The doctors there, the oncologists there told us that they are not giving chemo, and everybody knows that cancer is a disease now that is very widespread across our country and even internationally. And I think the Kisii County government should work on seeing to it that we start chemo sessions that may not call for much. Even if we do not have radiation, but I think we can do chemo in Kisii. Let's see from that what the vice they are saying.
The Senate has changed. Our job is to oversight the executive. We are not adversarial. We don't come here to make noise. We just want to look, observe. I now have a reason as the Senator of Kisii County to persuade the national government to give us more money. But I want to persuade the people running this facility, because I know most of them and I understand where they are. They should never fear to tell me where the challenges are. I want to be proud of this facility. The way Embarks, the Moi Teaching and Referral Hospital is popular and they are doing some wonderful things. That's how we want Kisii Referral and Teaching Hospital to become.
I hope senators, we have already indicated a few challenges have been observed, and more importantly about blood transfusion, that the blood that we transfuse here is actually screened in Nairobi. So if you're able to go to Nairobi and help us get a regional screening center in this area, as a county,